Your body, in its incredible wisdom, sends out crucial signals when something is seriously wrong. Recognizing these vital cues can be the difference between life and devastating tragedy. Today, we're going to delve into 7 critical physical symptoms that should absolutely never be ignored, under any circumstance. These are the blaring red flags that top medical experts emphatically state require immediate hospital care, no waiting, no hesitation whatsoever. This isn't about frightening you. It's about empowering and protecting you. Sadly, so many older adults delay seeking help, often assuming it's just a minor issue or, even worse, not wanting to trouble anyone. But the truth is, in numerous cases, swift early action can halt a small problem from spiraling into a major, life-altering crisis. And even more importantly, knowing precisely what to watch for puts you firmly back in the driver's seat of your own health journey. In this crucial video, you'll learn about the 7 urgent warning signs your body might send, signals that doctors insist you must never, ever overlook. These aren't vague, easily dismissed symptoms. They are very specific, undeniably real, and in many instances, critically time-sensitive. Please, stay with us until the very end, because one of these signs just might save your life, or the life of someone you deeply love. Now, let's get straight to it. Sign number 1, slurred speech or facial drooping. There's a very specific cluster of symptoms that doctors and nurses are rigorously trained to recognize instantly. These symptoms scream one thing: a medical emergency that absolutely cannot wait, a stroke. If you suddenly find yourself struggling to speak, if your words are coming out garbled, slurred, or unintelligible, or if you notice, with alarm, that one side of your face is simply not moving like the other, you must get to the hospital immediately. The very same urgency applies if you find yourself unable to lift one arm, or if it alarmingly drifts downward when you try. These are not signs to simply shrug off and rest. They are urgent indicators that your precious brain may be in grave danger. A renowned neurologist once chillingly stated, "Every single minute a stroke goes untreated, you lose nearly 2 million irreplaceable brain cells." Time isn't just money. It's your memory, your ability to speak, your movement, and indeed, your very life. That's a stark, hard fact, and one that far too many people don't fully grasp. In seniors, strokes can strike even without the slightest warning. You could be enjoying a perfectly normal day, reading the newspaper, relaxing in front of the TV, savoring your lunch, and then, in an instant, your words just won't form the way you intend, or your smile suddenly becomes tragically uneven. These subtle changes might feel odd, perhaps even a little strange, but not necessarily scary. And that's precisely what makes them so incredibly dangerous. Because when it comes to a stroke, the absolute sooner you receive treatment, the dramatically greater your chance of a full recovery. Take, for instance, our first example, meet Michael, a 68-year-old Vietnam veteran. One quiet morning, while peacefully having his coffee, he suddenly dropped his mug from his right hand, utterly bewildered as to why. He called out to his beloved wife, Sarah, but the sounds that came out of his mouth were all wrong, completely incomprehensible. Sarah, with incredible presence of mind, took one look at his face and instantly saw the horrifying truth: his smile was grotesquely crooked. Without a moment's hesitation, she dialed 911. Michael received critical treatment within the golden hour and made a truly remarkable recovery. If she hadn't acted so fast, he later shared, his voice thick with emotion, I might be in a wheelchair, or even worse, gone. The medical community wisely uses the acronym FAST: face, arms, speech, time to teach people how to recognize the telltale signs of a stroke. But the most critical part, the one people often forget, is that last letter, T, for time. That means every single minute is precious. If you observe slurred speech, any facial asymmetry, or sudden, inexplicable weakness, do not take a nap. Do not wait for a doctor's appointment. Call emergency services immediately and get help, because when your brain is in such dire trouble, acting with lightning speed could very well save your ability to walk, to talk, to remember cherished memories, and to live a full and independent life. Sign number 2, sudden chest tightness or pain. One of the most undeniably urgent signals your body can possibly send is a sudden, unexplained pain or pressure in your chest. It might manifest as an intense tightness, a crushing squeezing sensation, or even a frightening burning feeling. And alarmingly, this pain can radiate to your arms, shoulders, neck, or even your jaw. While some people might try to downplay it, desperately trying to convince themselves it's just a case of heartburn or mere anxiety, the stark reality is this: it could be your precious heart crying out for help. And in older adults, this is particularly treacherous, because the signs of a heart attack can be subtle, develop slowly, or be completely unlike the dramatic chest-clutching scenarios we often see on television. A seasoned cardiologist once shared, his voice heavy with concern, the number of patients who arrived at the hospital far too late because they tragically mistook their heart attack for simple indigestion is absolutely heartbreaking. If there's even the slightest chance it could be cardiac-related, get it checked out immediately. That statement carries an immense weight of truth, especially when you consider that many heart attacks in seniors don't present with the classic, crushing pain we see in movies. Sometimes, it's just a dull, persistent ache, a strange fluttering sensation, or simply an unsettling feeling that something is profoundly not right. You might also experience dizziness, sudden shortness of breath, or feel utterly exhausted, even without any recent physical exertion. These are absolutely not things to simply monitor and wait on. They are critical signs demanding immediate action. Let's look at another real-life example. Meet Eleanor, a vibrant 74-year-old retired school teacher. One peaceful afternoon, while engrossed in a book, she felt a peculiar tightness grip her chest. It wasn't excruciating, but it was undeniably persistent. "I thought maybe it was just gas," she later recalled, "but something deep down told me to call my daughter." Her daughter, bless her heart, rushed over without delay and insisted they go to the nearest hospital. There, the doctors confirmed Eleanor had suffered a mild heart attack. Thankfully, because she was treated so swiftly, she made a full and complete recovery. "If I had waited," she said, her voice filled with gratitude, "I might not be here today. Now, I listened to my body the very first time." And that, my friends, is the vital lesson here. When your body is in distress, it doesn't always scream. Often, it whispers. And with something as potentially fatal as heart trouble, those whispers can be your final warning. Don't wait until you're on the floor, gasping for air. If you experience chest discomfort that is unfamiliar, persistent, or accompanied by any other concerning symptoms, go. Don't wonder, don't wait, just go. If you're still with us and finding this information valuable, please comment with the number 2 below to let me know you're here. And if you haven't already, I highly recommend you subscribe to our channel and hit that notification bell so you don't miss any of our vital videos. Your support allows us to continue creating this important content to inform and inspire you. Now, let's move on to sign number 3, shortness of breath without exertion. There's a world of difference between naturally catching your breath after climbing a flight of stairs and feeling like you simply cannot breathe while you're sitting perfectly still. If you find yourself suddenly gasping for air during a quiet moment, perhaps while reading on the couch, watching television, or even just lying peacefully in bed, that is absolutely not something to brush off as insignificant. Sudden, unexplained shortness of breath, without any preceding physical activity, can be a glaring red flag for serious underlying conditions such as heart failure, pneumonia, or even a pulmonary embolism, which is a life-threatening blood clot that lodges in the lungs. All of these conditions demand urgent and immediate medical attention. A respected respiratory specialist once gravely stated, "If breathing becomes difficult for absolutely no clear reason, that is your body raising a deafening alarm." It's not just old age or simple fatigue. It's a desperate cry for help. That statement resonates with particular urgency for older adults. As we age, our lung capacity naturally tends to decrease, and our heart has to work harder to efficiently pump oxygen-rich blood throughout our bodies. But the critical difference between a normal sign of aging and a true medical emergency is how suddenly the shortness of breath appears and how severe it rapidly becomes. If you find yourself breathing heavily after simply walking across a small room, or if you wake up in the dead of night feeling like you just can't catch your breath no matter how hard you try, something is seriously wrong. It could be your lungs, your heart, or tragically, both. And waiting, even for a short time, could lead to worsening symptoms or irreversible, life-altering damage. Let's consider the poignant example of William, a spry 76-year-old retired electrician. He'd always prided himself on being in decent shape, but one ordinary evening, while quietly watching his favorite television show, he was suddenly overcome by a terrifying feeling that he couldn't get enough air into his lungs. There was no chest pain, no fever, no preceding activity, just this overwhelming, suffocating sense of breathlessness. His quick-thinking daughter, bless her heart, immediately convinced him to go to the hospital. There, doctors discovered a small but dangerous blood clot in his lung. "If I had waited until morning," William later confessed, his voice trembling slightly, "I honestly might not have woken up." That is the stark and vital lesson to take away. Shortness of breath is not something to simply monitor and address later. It demands immediate action, especially when it strikes suddenly, worsens rapidly, or makes even the simplest tasks feel like an exhausting workout. Trust your incredible body. It knows instinctively when something is profoundly off, even if you're not entirely sure what it is yet. If breathing becomes difficult for no obvious reason, please, go straight to the nearest emergency room. It is always far better to find out it was nothing serious than to tragically discover, too late, that it was everything. Sign number 4, unusual confusion or sudden disorientation. When a senior citizen becomes suddenly confused, alarmingly forgets familiar things, or appears utterly disoriented about their surroundings or even what time of day it is, it can be easy to dismiss it as just a part of getting older. But that kind of mental fog that descends rapidly, especially if it's completely out of character for that individual, is one of the most serious and concerning warning signs there is. It could be pointing to a stroke, a dangerous brain infection, dangerously low oxygen levels, or even a severe adverse reaction to medication. And every single one of those possibilities demands immediate and comprehensive medical attention. A compassionate hospitalist once wisely shared, in older adults, the brain is often the very first organ to signal trouble. Sudden confusion is like the body's emergency light urgently flashing. That profound observation is especially critical because many seniors and their loving families might not immediately recognize sudden confusion as the serious emergency it truly is. They might mistakenly think it's just a bout of tiredness or simply a bad day. But when the change is abrupt and significant, like suddenly forgetting the names of loved ones, getting inexplicably lost in familiar places, or speaking in ways that simply don't make any sense, it is absolutely time to take it with the utmost seriousness. These aren't gradual, typical memory changes associated with aging. They are abrupt, often shocking shifts that frequently signal something much deeper and far more sinister. Let's consider the story of Carol, an independent and sharp 80-year-old woman who lived on her own and capably managed all of her own affairs. One unsettling morning, her concerned neighbor found her standing in the hallway of their apartment building, utterly unsure of how she had gotten there or why she was fully dressed. She seemed visibly startled and kept repeating the same bewildered question over and over. Her worried family initially thought perhaps it was just dehydration or fatigue. But when they wisely brought her to the hospital, she was quickly diagnosed with a urinary tract infection that had tragically triggered a sudden onset of delirium. She received prompt antibiotics and fluids and, thankfully, returned to her normal, bright self within just a few days. "I had absolutely no idea that confusion could stem from something like that," her relieved daughter shared. "Now, I will never, ever ignore it." That is precisely the kind of positive outcome we all hope for. The brain is incredibly sensitive, and in seniors, it often reacts to other underlying problems like a developing infection, a lack of crucial oxygen, or even significant blood sugar fluctuations before any other part of the body shows obvious signs. So, when confusion strikes suddenly, completely out of the blue, please, do not wait for it to simply clear up on its own. It might, but if it doesn't, Or if it alarmingly worsens, the consequences can be irreversible and devastating. If you're still engaged with this vital information and finding these insights valuable, please take a moment to comment with the number 4 below to let me know you're still with us. And if you haven't yet, I strongly encourage you to subscribe to our channel and click that notification bell so you don't miss any future informative videos. Your continued support helps us tremendously in creating more good content to inform and inspire you. Now, let's move forward to sign number 5, severe or sudden abdominal pain. We all experience those nagging aches and pains from time to time, especially as we gracefully age. But when that pain is sharp, sudden, or feels like it's intensifying by the minute, particularly in the abdominal area, it is absolutely not something to simply ignore or try to wait out. Severe belly pain can be a clear signal of a serious medical emergency, such as appendicitis, a perforated ulcer, pancreatitis, or even dangerous internal bleeding. In older adults, abdominal pain can also tragically point to a blocked intestine or a ruptured organ, both of which can be immediately life-threatening if not treated swiftly and appropriately. A seasoned trauma surgeon once gravely explained, "When a senior citizen reports sudden, severe abdominal pain, we take it with the utmost seriousness because time is absolutely critical. It makes all the difference between a problem that can be easily fixed and one that could tragically prove fatal." That stark perspective should stay with you. Because for seniors, the risk of serious complications is often significantly higher, and the classic, textbook signs of illness don't always present in the same way. You might not even have a fever or any visible swelling. You might just feel profoundly off, or you might suddenly double over in excruciating pain without any prior warning. Either way, your incredible body is urgently trying to tell you something, and you need to respond quickly and decisively. Let me share with you the story of Franklin, a resilient 72-year-old widower who always prided himself on his toughness. One ordinary evening, while finishing his dinner, he was suddenly struck by a sharp, stabbing pain in his lower abdomen. He mistakenly assumed it was just gas, took some over-the-counter antacids, and went to bed, hoping it would pass. By the following morning, the pain had alarmingly spread throughout his abdomen, and he was so weak he couldn't even stand. His terrified daughter immediately called an ambulance, and the skilled ER team quickly discovered a dangerously twisted section of his intestine that had completely cut off vital blood flow. Emergency surgery miraculously saved his life. "I honestly thought it would just pass," Franklin later confessed, his voice filled with disbelief. "I didn't realize how incredibly fast things can go downhill." Sadly, Franklin's story is not uncommon. Seniors often tend to downplay pain or decide to wait and see if it improves on its own. But when the pain is sharp, persistent, or unlike anything you have ever felt before, it is absolutely not the time to try and tough it out. It's time to seek immediate medical attention. You won't lose anything by being cautious, but you could tragically lose everything by waiting too long. If you experience intense abdominal discomfort that simply doesn't go away, especially if it's accompanied by nausea, vomiting, or dizziness, please, don't guess. Don't Google your symptoms. Just go straight to the emergency room. Sign number 6, persistent vomiting or vomiting blood. Throwing up occasionally, perhaps due to some spoiled food or a passing stomach bug, is certainly unpleasant, but it usually resolves on its own. However, when vomiting continues relentlessly for hours, or if there is any trace of blood mixed in, it stops being a simple nuisance and becomes a very serious and potentially life-threatening medical concern. Persistent vomiting can rapidly lead to severe dehydration, dangerous electrolyte imbalances, and even kidney problems. And vomiting blood, no matter how small the amount, may tragically point to something far more dangerous, such as bleeding in your stomach, a torn esophagus, or ulcers that have ruptured. A knowledgeable gastrointestinal specialist once emphatically stated, "Blood in vomit is never, ever normal." It's one of the fastest and most alarming ways we identify internal bleeding in older adults. That statement should immediately stop anyone in their tracks, especially because some people might mistakenly shrug it off or misidentify it. The blood may appear bright red, which is obviously concerning, or it may have a darker, grainy appearance, much like coffee grounds, which can be equally alarming and unexpected. Either way, it is a clear and urgent sign that something is going drastically wrong inside your digestive tract. For seniors, this could be a reaction to certain medications, such as over-the-counter anti-inflammatories, a serious complication of an undiagnosed underlying condition, or even stress-related damage to the delicate lining of the stomach. Consider the sobering story of Evelyn, a 79-year-old woman who had been regularly taking over-the-counter pain relievers to manage her arthritis. One quiet night, she started vomiting shortly after dinner. Initially, she suspected the shrimp she had eaten. But when she saw dark flecks in the sink, what she initially dismissed as just old food, her quick-thinking grandson immediately insisted on calling for help. At the hospital, doctors swiftly confirmed that Evelyn had a bleeding ulcer that had been silently growing for months. "I had absolutely no idea it was that serious," she later admitted, her voice filled with a mix of shock and gratitude. "But if I hadn't gone in when I did, I honestly might not have lasted another day." This is a critical warning that simply cannot be overstated. Vomiting blood is not something that can wait until morning. It's not something to try and sleep off or to fix with a simple home remedy like ginger ale. It unequivocally means that something in your body is seriously broken and is leaking into places it absolutely should not be. Whether it's a damaged stomach lining, dangerous liver complications, or a burst blood vessel, only immediate and expert medical care can accurately determine the underlying cause and stop the bleeding in time to save your life. If you are still watching this crucial video and finding these insights incredibly valuable, please take a moment to comment with the number 6 below to let me know you're still with us. And if you haven't already done so, I strongly recommend you subscribe to our channel and click that notification bell so you won't miss any of our future important videos. Your continued support helps us immensely in creating more high-quality content to inform and inspire you. Now, let's move forward to the final sign, sign number 7, high fever with stiff neck and sensitivity to light. When you develop a fever, it's usually a clear sign that your body is actively fighting off some kind of infection. But if that fever spikes to a high degree and is accompanied by a noticeably stiff neck, a severe headache, confusion, or extreme trouble tolerating bright lights, it may be a telltale sign of meningitis, a potentially life-threatening inflammation of the protective membranes surrounding your brain and spinal cord. While meningitis is more commonly seen in younger individuals, it can absolutely affect older adults, especially those who have weakened immune systems or other ongoing health issues. And when it does strike, it can progress with terrifying speed far too quickly to ever ignore. A seasoned emergency physician once stated with grave urgency, if an older adult presents in the ER with a high fever and an inability to bend their neck, or if they exhibit extreme sensitivity to light, we drop everything. That's how critically urgent it is. That kind of immediate urgency speaks volumes. Because by the time these concerning symptoms appear, the infection may already be in full swing and causing significant damage. The stiffness in the neck isn't just a minor discomfort. It's your body urgently telling you that the delicate lining around your precious brain is dangerously inflamed. And the extreme sensitivity to light isn't just annoying. It's a serious signal that your central nervous system is under attack. For some individuals, these symptoms may also be accompanied by nausea, vomiting, or a terrifying feeling like your head is about to explode from intense pressure. And none of these alarming signs should ever be casually dismissed as just a common bug. Let's look at the experience of Gary, a sharp 75-year-old widower and avid crossword puzzle enthusiast. One ordinary morning, he found himself completely unable to finish his daily puzzle due to a relentless, pounding headache. By the afternoon, his neck had become so agonizingly stiff that he couldn't even look down, and the bright light streaming in from his kitchen window felt utterly unbearable. Thankfully, his observant neighbor, a retired nurse, immediately recognized the gravity of his symptoms and drove him straight to the nearest hospital. There, doctors quickly confirmed a diagnosis of bacterial meningitis. And thanks to that incredibly fast intervention, Gary thankfully survived this potentially deadly illness. "I honestly just thought I was feeling a little run down," he later recalled. his voice filled with relief. "I had absolutely no idea it could be something so incredibly serious. That is the stark reality. When your body sends out such clear and alarming warning flares like a high fever combined with a stiff neck and extreme light sensitivity, it is absolutely not an overreaction to take it with the utmost seriousness. And neither should you. These specific signs strongly suggest that something is aggressively attacking your delicate nervous system, and with meningitis, every single hour counts. Effective treatment is available, and it works best and is most likely to save your life when it is started as early as possible. So please, do not hesitate. If you or someone you deeply love begins to exhibit these concerning symptoms, do not wait for a doctor's appointment, and absolutely do not try to simply sleep it off. Go straight to the nearest emergency room and let the highly trained professionals take it from there. You will never, ever regret playing it safe when it comes to your precious health. But waiting, even for a short time, might be a risk you simply cannot afford to take. The valuable lesson we can all learn from these stories is profound. Never underestimate the power of listening to your body. Those subtle whispers, those sudden pains, those moments of confusion, they are not random occurrences. They are your body's way of communicating critical information, often signaling a serious problem that demands immediate attention. Acting quickly on these red flags can truly be the difference between a full recovery and a life-altering tragedy. Don't let fear, denial, or the desire to not be a burden prevent you from seeking help. Your health is your most precious asset, and it deserves your utmost vigilance and care. We would love to hear your thoughts. Please leave a comment below and share one thing you learned today and how you plan to use it in your life. Your insights are incredibly important to us, so don't hesitate to share them. Reading your comments gives us great motivation and encouragement to continue creating content that matters. If you enjoyed this video and found it helpful, please give it a thumbs up, subscribe to our channel for more vital health information, and share it with your loved ones. Your support helps us continue creating good content to inform and inspire you. Thanks for watching, and we look forward to seeing you in the next video.